morning. Unanipata? Unanisikia nianze? Yeah, good morning class. I hope we apologize. We had technical issues, but now it's time we start. I hope I'm clear. I'll just give you a few minutes to call your friends who've been waiting for us. We start. Kindly tell them now we are ready to start. Sarah, maybe also assist because I'm not able to see the class because I'm on the YouTube link of the students. I can't see my projection, so maybe you check on that. Yeah, thank you. Kindly tell them now we are ready to start. Yeah, good morning once again. Thank you very much for your patience. I think now we can start our class. This is lesson 8, topics to be covered. Today we will go through PEP, voluntary counseling and testing, PrEP, pre-exposure prophylaxis, needle. We also go through needle and syringe programs. So it's also known as NSPS for drug users for HIV prevention. We also go through post-PrEP care, and then we'll finish by HIV, AIDS, the drugs, ARV drugs. So welcome all to our today's class. It's a pleasure to present to you our topic today. So as we have seen in our first slide, our first topic to cover today is on PEP. So let's understand what is PEP. So PEP, or post-exposure prophylaxis, it's a HIV medicine that is normally taken immediately or soon after a possible exposure to HIV to prevent the virus from taking hold in your body. It is advised that you must take this within 72 hours, which is equivalent to 3 days. That is 24 hours times 3 after a possible exposure to HIV, or it won't work. Like maybe when cases of rape, the moment maybe we have cases of rape, that child or whoever has been raped, you're always advised immediately before the expire of 72 hours, you make sure you've taken the drugs so that it will prevent you, in case the person who raped you was HIV positive, it will prevent you from acquiring that virus. So, you know if you really need PEP. Number one, PEP may be right for you if you're HIV negative or you don't know your HIV status and you think you may have been exposed within 72 hours. There are many ways we get exposed to HIV virus, not just rape. Maybe you suspect, maybe you have been cut, maybe by a sharp object and you suspect the other person, maybe they are positive. Sometimes, maybe through some accident, maybe you undergo accident. Sometimes maybe you had sex with someone. It was not forcefully, voluntary, but you're not really sure of their status. Like the first point that it's during sex. For example, you had a condom break. Maybe you had purpose to have sex, but in the event you are using you're performing the event, the condom breaks with a partner of a non-HIV status. And I think this is the case for many people. You don't care the status of the person you're having sex with the availability of condoms everywhere, and they are freely available in all institutions. People really don't the status of the other person because they know, after all, we are having protected sex. But what if in the event you have a condom break? So the moment you suspect, because sometimes not about feeling, you can not feel, but you're infected. So the moment you have a condom break, you're advised to rush to the nearest hospital center, go report the case so that you can be put under PEP, and make sure it is before the expire of 72 hours. that is equivalent to the 3 days. Yeah, you count hours from the same headsets, you count 72 hours from that point. Then also through shared needle and syringes or other equipment used to inject drugs. Maybe sometimes this one even could be even in the cases of in the hospital, maybe nurses sometimes they prick themselves by mistake after attending to a patient. Sometimes they are not sure if the patient is positive, so that you don't take chances. The moment you have such cases, you also go and you ensure you put under PEP, the post-exposure prophylaxis. This is sometimes you can take pre. We'll see what is pre, but now we're talking about PEP. It's post. So once you have suspected, maybe you're suspecting you have come into contact with the virus, then you put under PEP. Then through sexual assault, we've talked about cases of rape. So you've been sodomized, all those cases. You're not really sure about the status of that person who has raped you or sodomized you. So the best thing is the statement is saying contact your healthcare provider immediately or go to an emergency room or urgent care clinic right away, and you request for the PEP. You request for the PEP. How to prevent occupational HIV transmission. We've been in the first slide. We have seen whereby you can be exposed to HIV through those who work in the hospital, like nurses and doctors and medical practitioners. You can be exposed to HIV and AIDS. So how can you prevent the occupational HIV transmission? One, if you're a nurse, use gloves or goggles and other barriers when anticipating contact with blood or body fluids. The moment you know you're going to be into contact with blood, maybe injecting patients, addressing their wounds, maybe those who are from accidents, because sometimes you could be having a wound, so you don't ignore that fact. So you use gloves, use goggles and other barriers to prevent yourself from acquiring the virus from the other person. Number two, wash hands and other skin surfaces immediately after contact with blood or body fluids. As you attend to these patients, ensure, because chances are very high you will come into contact with their blood or body fluids, maybe cases of burns, injuries. So make sure you wash your hands and skin surfaces immediately. You sterilize yourself. They normally advise 70% ethanol is also very important. Then use safety devices to prevent needle stick injuries. And then dispose of any used syringes or other sharp instruments in a sharp. Once you've attended to the patient, don't just keep that syringe there. You normally see once they are done injecting the drugs, you normally cap it back, then you dispose it well. So that is something you need to put into consideration. I'm sorry for that. Yes. Okay. So what happens if an HIV exposure happens at work? So this, we are talking about the medic practitioners. What happens? So make sure you report your exposure to the appropriate person. Don't ignore. And remember, we have said within 72 hours. So report your exposure to the appropriate person and see a doctor or visit an emergency room immediately, because PEP can always reduce chances of you and AIDS, because in the event that you had any virus, before it starts infecting your immune cells and multiplying and replicating in your immune cells and moving, and now moving through your blood system, this one will really work on, if there is any virus, it will work on it within 72 hours and you'll be sure you'll be safe. So clinicians caring for personnel who've had a possible exposure can call the PEP line number. So in case you are exposed to HIV at work, please report to the appropriate person. Yeah, how long do you need to take PEP? So this is something else we need to know. I remember in our last lesson I told you these drugs, they are not as easy as some of us we want to assume, because they work on your body like someone who has HIV and AIDS. So don't be careless, unless, just make sure the moment you're using PEP is unless otherwise. Like you didn't have others, maybe during as you're working, you've been exposed to HIV and AIDS, but where you can avoid cases that will lead you to taking these drugs can be avoided. So how long do you need to take this? If you are a prescribed PEP, you will take the HIV medicine every day for 28 days. You can imagine taking these drugs for 28 days. This is almost a whole month. You will also need to return to your healthcare provider at a certain time while taking PEP, and after you finish taking it, they also do a testing. So what they do, they'll give you these drugs for 28 days and they'll do a proper monitoring on you, because they need to know whether if you had any exposure to virus, they want to know whether the drugs has worked. You know, for every day for 28 days, this is enough time. So once you're done with the 28 days and they test you and you're negative, now they can confirm that you are safe. So you take it for 28 days. Yeah. How well does PEP work? So PEP is effective in preventing HIV infection when it is taken correctly, but it's not 100% assurance. So even the HIV drugs, if you want to be safe that it will work well for your system, you have to take it properly. So you can rely on PEP when you're faithfully taking it for 28 days. The way they have prescribed it for you, you have to take it for 28 days. But you see, there's another caution here. It is not 100% effective. So where you can avoid cases of ignorantly thinking, I'll do these things and go and get this PEP, kindly, you don't know what you might be doing to yourself. So if you take correctly, it will prevent you from HIV and death, but also the medics still say it is not 100% assurity that you'll be protected. So while taking PEP, it is important to use other HIV prevention methods. So don't use PEP at the same time you're protected sex, at the same time you're sharing syringes or abusing drugs. So you need to be very careful. Taking PEP, it is important to use other HIV prevention methods such as condoms, the right way, ensure you're wearing them the right way every time you have sex, and using only new sterile needles when injecting drugs. Because some will still decide to continue with their way of life. So even when you're taking those drugs, kindly be very careful. So don't be careless because you're taking PEP, because the PEP that you're using for 28 hours could be preventing you from the earlier exposure. But now you see you're still exposing yourself, so you will not have like 100% assurity that you'll be safe. Ways of preventing HIV. What are other ways of preventing HIV and AIDS? As we've seen, these drugs, they are not easy as we think. Sometimes also the availability. I've had people complaining of the availability. You know, the system in Kenya, corruption. So sometimes you even find these drugs are hidden. Sometimes they are not enough. So it is not like 100% when you have an exposure, like it's 100% guarantee I will access these drugs. The same way when people have accidents, you see, some of us donate blood, but when you go to hospital, the reality will down on you. You're not sure that you'll get the right blood, your blood group, sometimes they hide. So it is always important. Let's think of how we can prevent HIV and AIDS instead of just thinking how I will expose myself and use PEP. So what are the other ways of preventing HIV and AIDS? So number one, choose less risky sexual behaviors. Like receptive and anal sex is the riskiest. Those who are homosexual. And as you go back to our theories, we saw homosexualism we think it was one of the reasons why God punished us and gave us HIV and AIDS. And it was also discovered, like in USA, many homosexuals were HIV positive, and it's because of this anal sex thing, because the membrane of the rectum, it's normally very thin, and it has, and now chances of and you see there's also something else I was telling my class last time. When you have anal sex, there is nothing like lubrication. So that's why we normally experience cases of rupturing. And once there is that rupturing, the virus gets transmitted to the body fluids, the blood and the semen and all those things. So always choose less risky sexual behaviors. Avoid behaviors like receptive anal sex. It is the most riskiest type of sex for getting or transmitting HIV, since they say the lining of the rectum is thin and may allow HIV to enter body during anal sex. Also, vaginal sex also carries a risk of getting or transmitting HIV, though it is less risky as compared to the anal, but also people get HIV, transmit HIV to their partners through vaginal sex. So in all this, just to make sure if you know the status of your partner, or use protection. If it's condom. Another thing, oral sex. It carries little to no risk of getting, because it means your partner ejaculating the semen into your mouth. You can imagine. So oral sex carries little to no risk of getting or transmitting HIV, because it happens when the man ejaculates in the partner's mouth. So the chances are very less. As we said last time, it's the same way when someone has a suppression. When someone is faithfully taking their medication, it means that the replication of the virus is really reduced. And this, when someone is tested, they can even test negative, but they still have the HIV virus. But this is the moment whereby even if you have sex with this person, because the virus is really low, chances of you transmitting the virus to this other person, it is normally very reduced. So it's the same way with oral sex. The chances of you ejaculating enough virus to your partner's mouth, it is also very reduced. But it's also another risk you cannot ignore. So what are the other ways of preventing HIV? Like use of condoms. They are highly effective in preventing infections like STDs, gonorrhea, and HIV. But as we have said, sometimes you can have cases of condom breaking up. So make sure if you decided to go that way, you wear the condoms properly, you wear them well for your safety. Another thing, talk to your doctor about the PEP. Taken daily as prescribed can stop HIV from taking hold. So also, when you suspect you're exposed to the virus, kindly immediately within 72 hours, go see a medic. And once you're given the medication, please take them faithfully so that you are sure after the 28 days you are safe from the virus, because it will have worked on the virus. So what other ways of preventing HIV and AIDS? It's just more of like repetition. Take PEPs within 72 hours after possible exposure. Number 2, encourage your HIV positive partner to get and stay on HIV treatment. So like maybe you discover one of you is positive, and guess sometimes you realize that one person is not positive. You can have maybe one partner was unfaithful and the other one was okay. And by the time when you met again, you realize that one of them was infected. So just encourage that person, be kind to that person, take them to the care center, health care center, ensure when they're given their medication, you faithfully remind them to take their treatment well, because if you decide to keep up the relationship and your partner is not taking their medication faithfully, they will end up transmitting the same HIV to you. But when you encourage them to faithfully take their medication, you will still have a very safer relationship, because as we have said, there are those who take their medication treatment carefully, faithfully, and also their body don't develop resistance toward this medication, and they can even test negative. And these are people who really live for long. Another thing, other ways of preventing HIV, you get tested and treated for other STD and encourage your partner to do the same. So if you're in a relationship or in marriage, important with the nature of work nowadays, we'll find maybe one partner we say people are geographically bachelors. Sometimes you're just separated by the distance of work. You don't know what your partner does. So it is important in a relationship, just keep going back for testing to know the status of another person. Because I know of a case whereby the man was infected and the man used to work far away. The man was infected and the man never told the woman. So faithfully, she has been there faithfully waiting for the husband, and the woman got infected. And the woman knew after 3 years that she was infected when she was seriously sick, and the doctors had to put her under all kind of tests, including HIV test, and she turned positive, and she was shocked because she could not believe she was positive. She could not believe like she has been ailing because she's positive. She has been treating other illness like malaria and pneumonia, but she never knew that the real cause, what has been weakening her immune system, was HIV and AIDS. So please get tested. Reduce your number of sexual partners. This mostly I think men. Some feel there is this, you feel like you're more of a man when you have like a much have sex with multiple partners, but sometimes you really don't know what you're exposing yourself to. So the more you're likely to have partners, I'm sorry for that. Yeah. So, just a minute. The more you're likely to have partner with HIV whose load is not suppressed, the more danger you are in, because as you keep exchanging partners, you don't know who is HIV positive, and you could be having sex with someone who is not even careful, who is not even taking their medication. They know their status, they are not taking their medication faithfully, meaning the viral load is very high, and the moment you have sex with these people, just at the first instant you get infected. So decide not to have sex, abstain. I think for me, I would say that is the most important bit. Always practice patience, because as students, you know what brought you here, and after 4 years you'll account for every hour, and I'll assure you that time is flying. In the next, starting our exams, and you realize one semester is down, you have now 7 semesters to go. So decide not to have sex, abstain 100%. This is the most sure way. And then know your HIV status. It's always good, just go get you turn positive. There is life after HIV, and as you can tell, people nowadays, they say HIV doesn't kill. I think cancer is more real than cancer is really killing, and people have HIV and they're living long, they're taking their medication faithfully. So kindly know your status. Okay. Does PrEP cause side effects? This is another important thing. I remember telling you, I know of a person who was taking PrEP and it was not easy. So side effect. PrEP is safe, but the HIV medicine used for PrEP may cause side effects. Yeah, you might experience side effects. Sometimes it is not easy. Some people, they experience nausea. In almost all cases, these side effects can be treated and aren't life-threatening. So yeah, there are those cases that you really feel like you want to give up on those drugs. But please, however bad you will feel, sometimes you may feel nausea, please take them faithfully for 28 days. And if you feel that the side effects are too intense, also don't ignore, go back to the health center, get advised, but don't advise yourself because you're not a medic. Okay, if you're taking PrEP, talk to your healthcare provider if you have any side effect. That is what I've just said. So in case you experience any side effect, please go back there and get advice accordingly. PrEP medicine may also interact with other medicine that person is taking. I know when most of us will go to the hospital, normally before the doctor prescribed a medicine to you, will ask you or she will ask you, are you currently under any medication? Because there are medicines. When you're given some medication, they might interact with other medication and they might end up affecting you. So they may also, people can also interact with other medicine that you are taking. So there is something known as drug interaction. For this reason, it is important to tell your healthcare provider about any medicine that you're taking, and they will advise you accordingly. Yeah, so also tell them whether if you're sick, let them know so that you don't give up taking the drugs because the PrEP is reacting with the drugs and you end up exposing yourself to the virus and allowing you to win. Yeah, can you take PrEP every time you have potential exposure to HIV? No. Yeah, so don't be careless in the name of there is PrEP. No. PrEP should be used only in an emergency situation. And you see, PrEP, as we've agreed, it's a post-exposure prophylaxis. PrEP is what you take after you suspect you are exposed to the virus. You can be exposed to the virus through sex, as we have said, injuries, injecting, using sharp objects. So, no, PrEP should be used only in an emergency. It is not intended to replace regular use of other HIV prevention methods. Like, you don't ignore using condoms because you know you'll obvious use PrEP. So this one is, don't replace it with other ways of how you can prevent HIV, like knowing your status, abstaining, using condom, like that, knowing the status of your partner, encouraging them to go get tested, and taking their medication if they turn positive. So if you feel that you might be exposed to HIV, frequently talk to your healthcare professional about PrEP. That's what we are going to see now about PrEP, the pre-exposure prophylaxis. So I think up to there, we are clear what is PrEP and when PrEP should be used and when it should not be used. Yes. So what is PrEP? PrEP exposure. It is pre-exposure prophylaxis. It's for people who are at a long-term risk of getting HIV, either through sexual activity or by injecting drugs. So if you're taking PrEP and come into contact with HIV, the medicine makes it difficult for the HIV to develop inside your body. So like maybe if you're a medic and you deal with situation that you suspect will expose you to the virus, now you take PrEP. This one is a pre. You take it before. Like before you engage with those patients, you take it. In case of any injury of injection, pricking yourself by mistake, maybe your wounds coming into contact with the bloods and the fluids of those patients, you will be safe. It will make it difficult for HIV to develop inside your body. What do you mean when you say develop? It is the virus infecting the immune cells, multiplying and keep on replicating and infecting even more immune cells and weakening the immune system. I hope now that is clear. So there is difference between PEP and PrEP. Yeah, can you get help? Can you get help paying for PEP? So generally we have seen what is PEP or PrEP. Now you have been exposed to the virus. This because it's talking about now you're under medication. So the question is, I'm sorry for that. The question is, can you get help paying for PEP? If you are prescribed PEP after sexual assault, like those who are sodomized, raped, we've been hearing such cases in our news. So you may qualify for partial or total reimbursement. Sometimes you pay for this, you'll be reimbursed. Once the case is reported, you have to be reimbursed for medicine and clinical care costs through the Office for Victim of Crime, funded by U.S. Department of Justice. Also, if you're prescribed PEP for a mother reason and you cannot get insurance coverage, your healthcare provider can apply free PEP medicine. I hope that is clear. So if you're prescribed, if you've been told to take the PEP for 28 days for another reason and you cannot get insurance coverage, your healthcare provider can apply for free PEP medicine through the medication assistance program run by the manufacturer. So there are those foundations that work hand in hand with this medication, and so your healthcare provider can apply for free PEP medicine through the medication assistance programs run by the manufacturers. So this request can be handling cases to avoid a delay in getting the medicine. I'm just hoping, because most of these systems work well in developed countries like USA. I hope such system can work well for countries like Kenya and other developing countries. If you are a healthcare provider who was exposed to HIV on job, your workplace health insurance or workers' compensation will surely pay for your PEP, because these are people who need such insurance because they work with these patients every day. Sometimes we have accidents every day occurring, we have people getting sick, so these people, they have to have this insurance that assure them that in case they are exposed to this, then there is a compensation, so they will always, their PEP should be paid for because they are getting exposed in the line of their work. Yeah, so I think up to there now we are clear. I think from our first slide, we were to talk about PrEP, and now we also talk about NSPS, known as Needle and Syringe programs for drug users for HIV prevention. So this is something governments and many NGOs are coming in place to see, because number one, sometimes it's hard to stop things. Like it's hard to say no more drug abuse. We all know there are drugs that are prohibited, but they are still on sale. When you go to a place like Mombasa, you will see how those young boys, they are into drug addictions, the bang, the marijuana, and they are living very hopeless life. So the most important thing sometimes, if you cannot stop people, see how you can prevent them. If they have to continue abusing drugs, then how can you ensure as much as they are abusing drugs, they are not spreading the HIV virus? What can you do? So those are programs that was brought up, known as needle and syringe programs for those drug users, so that the virus can be stopped, can be prevented, or can be minimized. So needle and syringe programs are a type of harm reduction initiative that provide clean needles and syringes to help those who inject drugs, also known as PWID, so as to reduce transmission of HIV and other blood-borne viruses. Because by then you can infect someone with other form of viruses like hepatitis B, C, not just HIV and AIDS. And I know in our first topic we realized we have strains of the viruses. So these programs, they have been put in place to provide syringes, and that's why the name is just clear that needle and syringe programs. So they provide syringes for these drug users, so that even as they are using and abusing the drugs, they are also prevented. They are also helped, so that they don't spread the virus from one person to another. Okay, so the program aimed primarily to reduce the transmission of HIV and other blood-borne viruses caused by the sharing of injecting equipment by, number one, the advice on safer injecting practices. These programs, they normally go to areas where they know people are easily exposed to the virus. Even sometimes they talk to the prostitutes, those who practice, the sex workers. They go to those people who abuse drugs, those kids in the street, and they start advising them on safer injecting practices, like don't use one syringe more than one person, don't share injecting syringes. So they advise them on safer injecting practices. Number two, they advise them on minimizing the harm. They advise on minimizing the harm done by the drugs. Like they take them through the drugs, they take them through the effects of the drugs they abuse. And therefore, this one will help them to minimize. They start minimizing some might be receptive, they might be positive, and they will minimize the use of the drug, and therefore they'll be reducing the harm done by these drugs. They also advise on how to avoid and manage an overdose. They also information on the safe handling and disposal of injecting equipment. Like they tell them after using this injection, kindly drop it here, kindly don't use one syringe for more than one person, and also referrals to HIV testing and treatment services. They also advise them to go get tested, know your status, and screening for other sexually transmitted diseases and tuberculosis. Because this is an NGO that works on this. Sometimes they come, they do testing on them, they screen for other sexually transmitted diseases and tuberculosis, testing drugs, including access to drug treatment and encouragement to switch to safer drug taking practices, and link to other HIV prevention interventions such as PrEP. Because this is just a program that now is there to help those people who abuse the drugs. So they go to an extent of testing them. When sometimes they realize some are positive, now they give referrals to them. When they realize some have just been exposed, they advise them on PrEP. And sometimes if they know this, like those people who are at a certain age, whereby at a certain stage, we call them, they cannot live without that drug. They have to continue. Their system can only operate after an injection. So they advise them using drugs like PrEP, the pre-exposure, so that even as they continue that practice, in case they get exposed to that virus, they'll be safe. Yeah. What is a psychosocial support? I know this statement was in a certain slide and I thought it was important. Yeah. So referrals to other healthcare services, wider psychosocial support and counseling. Sometimes for you to deal with a problem, now you go to where the problem is affecting. Psychosocial support is whereby you address a personal, emotional, social, mental, and spiritual needs. Because sometimes it is not enough just to condemn the drug abuse, because some too far. Some started in their high school, some started in their campus, some it has been their way of life. So sometimes you now go deeper into the problem, start addressing the needs of that person. Drugs. I know some abuse drugs to forget their problems. Some abuse drugs, maybe they've gone through some emotional torture. Some have been sodomized by their parents, raped by their parents. They have to start drinking, the trauma in them. So psychosocial support, those needle syringe programs, they also offer the psychosocial support. They start addressing the personal, emotional, social, mental, and spiritual needs. All these are very essential elements for proper human development. Yes. So, how are needle and syringe programs delivered? We have agreed this is a program that has been set up to help those people who are drug abuse, and mostly those who do the injection, those who use drugs by injecting. So we have seen they go ahead, they offer counseling and testing, they offer injection, they advise them on proper disposal. So how is this program delivered? One, fixed sites. They are typically located in areas with high levels of injected drug users. You can realize maybe in Embu we have a certain area where people go to abuse drugs. So they normally go and camp there, like they'll have their station there. So they'll go to a place where they know in that place they have many people who abuse drugs in the way of injecting drugs. So they can be drop centers, community centers, pharmacies, or specialized voluntary counseling and testing centers. So these are, when you talk about fixed site, they identify those places where they have those many people abusing drugs in the way of injecting, and now they have a station there, and in that station they offer all those kind of services. They offer the counseling services. They advise them on the treatments. They make referrals to them, and they even supply syringes to them. Another way how they deliver their program is by mobile programs. This is, they operate from van and bus. It's like you normally see how they normally do advertisement. We can have just maybe fixed site, and they also move from one point to another. So this one they operate. They use either van or a bus with needle and syringes distributed through a door or window. So they've gone to a point of whereby now they visit. They go to other places, visiting these people who abuse drugs and supplying to them needle and syringes. It's like telling people, if you have decided to be abusing these drugs by injecting them, do it safely so that you don't increase cases of HIV transmission from one person to another. Number two, outreach programs. They take many forms, including mobile units, backpacking services, which are delivered on foot at street level. So this is like, for Christians, we normally say outreach. We go where you go door to door with. So also they do that. They outreach. They go door to door, just on foot, talking to people, advising them, encouraging them. Some carrying these syringes, distributing to them, and just trying to encourage them on safer way of injecting themselves if they've decided to do that. Also advising them how they can avoid that injection, or how they can avoid the drug abuse. Just now this one will be on food. It's like preaching to someone. And then for developed countries, they have syringe vending machines. So this is a machine, like there was this machine for China as well. People would place coins. There's a way it was operating. So they have such a kind of machine. Those machines have syringes in them. But you put a coin. Once it accepts your coin, it gives you token. The token in return is now the pack that has the syringe. And another thing, pharmacies, they operate a number of ways. Some sell, some can sell this. Okay, some programs they deliver through pharmacies whereby they can sell the syringes to these drug users, or they can give them for free, depending on if the country has subsidized that. Yes, I think it is the same way like what happened to the cases of condom. And I think initially we had a debate whereby the government wanted now condom to be also provided in the secondaries and primary school. I can tell you that's how far, because they realized like in campus you cannot micromanage adults. So the best thing, instead of thinking you can tell people to abstain 100% and it's something you cannot manage, then why not go ahead and give these people condom? I'm trying to emphasize what this needle syringe program does. Like, it's like if you cannot prevent people from abusing the drug, then help them to abuse it, but more safer. So if you cannot advise people on abstaining 100%, because that is one of the most sure ways, then let them have that sex, but have it safely. So provide condoms to them. So that is also how this program works. If you cannot prevent people from abusing drugs, then help them. Have these fixed sites, have mobile programs, go outreach, door to door on foot, talking to them, having these vending machines where they put their coins, they get their package of syringe, or some pharmacies sell to them at a manageable price or give them for free. So I hope up to there, that is very clear to all of us. So we have covered the needle syringe program, we have covered PEP, we have covered PrEP, and now we also to look on the voluntary counseling and testing. So this is like the mother of everything, because even before you get to know you're positive, you start there. You go to a visit, you get tested. But before you get tested, you have to follow the procedures, the voluntary, the counseling, and it must be first voluntary, you go for counseling. So let's now look at voluntary counseling and testing, what we call BIS. It allows individuals to learn their HIV status through pre- and post-testing counseling and an HIV test. This is a place where no one forces you to go, and that's why the word is voluntary. But this voluntary must be accompanied by counseling. So I will not just volunteer myself and then I go straight to testing. What if I turn positive and I was not ready? What if I turn negative and I was thinking I'm positive? But you see, the moment I go for this voluntary, I volunteer myself to go for this testing, and the first thing I need there is counseling. It really helps. This is what is among the things we call psychosocial support. It is very important for your mental health, because HIV mostly not because even of how the virus is replicating in their immune system, but already they are emotionally dead. They have already given up. They're like, this is now the end of me. So it is voluntary. This means that after now counseling, you are guided on how the testing will be done. What if it turns positive? Is there life after positive? Your advice. And I'm telling you, sometimes I think these people, they normally have very good skills, because if they cancel you, they make you even turn positive, at least I have another chance to move. And of course, yes, that is the truth. Just because you are positive, you have chance of living anyway and living very normal. And I can tell you, it's only that the HIV doesn't write itself on our foreheads. You'll be surprised the many people who are living good lives and they're positive. So it's how you take it. So voluntary, this means that getting tested for HIV is your choice. You decide if and when you get an HIV. I think for me, where I can say it is normally like mandatory. It's like before, if you want to do a wed, if you want to wed, in fact, in church weddings, your pastor will send you. It is now that he makes it mandatory, because he will send you, go with your partner, go get tested, bring your results back. But it should be voluntary. It's like it should come from you. You just carry yourself, you walk there and you go for that testing. It should not be forced. Then counseling. So voluntary counseling and testing includes counseling before and after the test, as we have said. There is what we call pre-test. So before they do the testing on you, they first take you through the procedure, and they explain to you what will happen in case it turns positive, how it will look, in case it turns negative, how it will look. They will go ahead and tell you if it turns positive. In fact, they'll give you hope before, and they tell you if it turns negative, then good and well. So they'll do a pre-test counseling, includes a private session with a counselor who will explain the testing procedure and how the results will be given. He'll even tell you how the results will be given. So you'll have the chance to ask questions about the test and share any fears. So that is the time you're very free to ask questions. Maybe you share your worries, your fears, and he really prepares your mental, like he prepares you mentally to how you will accept the results, how to take the results, however they will come, whether they will be positive or negative. You can then decide if you are ready for the test. And by the way, when you go for the counseling, I have heard of people who go for testing and they leave that place having not been tested. Because I think, hey, you know, there's a way. I know something funny about counseling. They always talk to you like you assume like you're already positive. But like they start preparing you, what is your positive? They normally really prepare you for that. And so sometimes you might feel, I'm not ready. You can decide to leave and you come another time. Now in post-testing counseling, so this is now after, if you've decided you are ready, you'll be tested. Now, they'll give you a post. Now, your results, they'll give you a post-test counseling, and the counselor will support you as they tell you the results of their test. They will help you make immediate plans and provide referrals for medical care. In the event that you're negative, they'll tell you, go well. But if you are suspecting you've been exposed, they can tell you maybe you come after some time again, you do another test. But if they realize that you're positive, now they have to do proper counseling on you, helping you to accept your status. You're positive, they help you to accept it positively because it's already positive, so you also accept it positively. And now they advise you, and they will always advise you, once you turn positive, they will always advise you to start medication immediately so that you don't progress. Those who remember the question in part 1, you don't progress from HIV to AIDS, whereby now your system is weak and exposed to all manner of diseases, opportunistic infections. So they will always make those referrals to you. You'll be shocked how when you're really faithful in your medication, you start your treatment immediately, your body will start responding well. Yeah, testing, the most common way of testing for HIV uses a blood sample, but there are other oral swabs available in some places. I think most of us, we are used to the blood testing, but they can also do the oral swab because, as we said, virus is in the fluids, saliva, and the semen, vaginal fluids, and in the blood. So there's something, I just wanted us to go through the voluntary counseling and testing. It's voluntary counseling and testing. It's like more of a class, how you should introduce it. Like you can choose to introduce the lesson. So many people who have HIV do not actually know their status because they have never been tested. So when you want to take someone through session of voluntary counseling and testing, you have to properly introduce the lesson to those students. Like, let them know. Because I've said many people who have HIV do not actually know their status because they have never been tested. They don't know, they've never gone for these testings, they have never tried knowing if they are positive or negative, they've always been in fear. So you have to properly introduce that to them. Like you explain to them whether if you're positive, what happens, if you're negative, how the test will look like. So you can have a pass out, a flowchart worksheet to each participant. You ask them to follow the steps of VCT as you explain the process to them. You can decide to offer such, like this is what I'm doing to you. You can offer such lessons even to your students. Like ask them to follow the steps of VCT as you tell them what to do. Like you first, you must volunteer yourself. You will take yourself there to the VCT. No one forces you there. Now you start explaining to them the whole process, how it starts. So ask them to follow the steps of VCT as you explain the process, writing their own notes directly onto their worksheet. So as you define each component of voluntary testing, start explaining. That is what I did as we started. I told you what is V, what is C, and what is T. I must volunteer myself first. Then after volunteering myself, meaning mentally, emotionally, I have decided, I have carried myself to the health center. Yeah, they need to offer me counseling first. They cannot just start testing me first. They need to offer me counseling first. Then once I'm psychologically prepared for the testing, now they can test me. Yes. So another thing that should be known, once you're tested, you can be negative or you can be positive. So a negative result means that antibodies were not found, indicating either that the person has not been infected. Once you're tested, you can be negative or you can be positive. So if your result stands negative, it means the virus has not been detected in your system. So in the 2 to 3 month period after infection, it is too early for antibodies to have formed. But I know of late we have rapid tests. They just confirm your status. But back there, once you suspect maybe you have HIV or you suspect you've been exposed to HIV and AIDS, when you go for your testing, they'll tell you you go stay like maybe for 2 to 3 months. And sometimes I was wondering, in these 2 to 3 months, what happens in your mind? HIV it's more mental. To me, I always think HIV it's more mental than even like how it affects your system, the immune system. It is more mental, because in these 2 to 3 months you're still imagining, what if I turn negative, what if I turn positive? But thanks to the technology that has really improved the situation, and you can, and you're sure when you go you're negative or you go you're positive. So that's why they say in 2 to 3 months period after infection, it is too early for antibodies to have formed. This period is called window period. To be absolutely accurate, the test to be taken twice in 3 months again, giving antibodies time to appear in the bloodstream. Yeah, that's what I've just explained. So pass out copies of handout to each participant and use the illustration to explain the window period further. So I think I'm just taking you what, like when you go to that visit, this is what actually should be happening to you. And then open the floor for participants to ask any question. Make them free to know where they are not clear. Let them ask questions. Let them know when someone is positive, and when it's positive, it just turns positive, and it means the antibodies have been detected. It means virus has been detected in your system. But they always say immediately you turn positive, they have to immediately do another test, because like you cannot just declare someone is positive in the first test. It is advised. When someone is negative, you can tell them go, come back, we test again. But when someone turns positive, immediately you must conduct another test to confirm that that person is negative. It's positive. Yeah, I think that is all. I will not repeat because I was just explaining. It was just a session I wanted to take us through there. So now we have gone through the voluntary counseling. Now there's something I want us to talk about known as post-rape care. In the event that someone has been raped, of people being exposed to HIV through drug abuse, where mostly those who inject drugs by sharing syringes. We have people who now get exposed to HIV and AIDS through rape. So it is very important how now you treat that patient, because rape mostly comes with a lot of mental torture. Number 2, this person can be exposed to the HIV. So it comes with mental torture, and also the person can be exposed to the HIV and AIDS. So how you care for this patient is very important. So post-rape care, what does it involve? It involves providing comprehensive, underline the word comprehensive, post-rape care, including offering PEP to the survivors in 2 hours. In fact, if there's one thing that should be done immediately, you receive a case of rape, before anything else, put them in medication immediately, and always make sure it's within 72 hours. Because just in case, even as you start treating the mental torture, work first on the virus, because with time, the mental torture will be healed. But what if this person was exposed to the virus? Now you have again to start teaching them to accept and start living with it. This is something you could have avoided. So this can help reduce the risk of HIV infection. Comprehensive post-care addresses the full range of health, psychosocial support that we have talked, and police and legal justice needs of rape survivors. Like sometimes, so that is when you talk about comprehensive post-rape care, the psychosocial support comes, the medication bit comes, now the justice bit comes. If it's the father or a man or whoever was found raping that person, then justice must be delivered for that survivor. So in the immediate term, it includes PEP for HIV and other STI emergencies, contraception, assessment and treatments of injuries, and women-centered care. So health providers also play a critical role in collection and documentation of forensic evidence, because you see now when there are those who get reported and they deny the fact that they raped the person. So what happens? The health providers will really help, because you see there is that first evidence. Definitely, if you raped someone, your body fluids will be found. And now the swabbing of that body fluid is very important. It will be used in forensic as evidence that can support criminal prosecution of the perpetrators. So if if the survivor wishes to pursue for justice, you must have evidence. But then when you go to the court of laws, if you listen to cases, you can be right, but just because you lack evidence, everything is trash. So evidence is very key. So therefore, provision of comprehensive post-care rep requires strong coordination and referrals between the health, the police, justice, and social services. And that's why we are talking about the comprehensive post. That's why we're talking about the comprehensive post-rep care, which includes all health, police, justice, and social services must be offered. Okay. Comprehensive post-care remains inaccessible to the majority of survivors worldwide. What are the reasons? We have witnessed, we have heard in the news cases of people who've been raped, and we know justice has not been delivered. So why does it still remain inaccessible to the majority of rape survivors worldwide? The reason one is limited availability of services. These services are limited. Also, stigma and insensitivity served by survivor. You can imagine that child, how, and that's why I always announce news, those who announce news, you realize they normally don't show the face of that person, because you can imagine when it's known to the public that you are a survivor of rape, already there is that stigma. So stigma has also hindered the accessibility of this comprehensive post-rape care. Also a lack of information and awareness about services. How many, and I'll not be shocked if most of you listening to me are not aware of something like comprehensive post-care report. So also lack of information is another thing. As the Bible says, may people perish for lack of knowledge. If we lack knowledge, if we lack information, then we cannot benefit from the services that are there. Then delay due to poor police procedures, and some people, they can even buy police. Some police are reckless. Some, as it happens, some don't see the seriousness in it. So when they are delayed and there is no evidence, like the forensic evidence that is normally provided by the health people, maybe no one was there at the scene, like maybe those delay in the police procedures, you realize that the survivor will not benefit from this comprehensive post-rape care. Limited coordination between police and medical services, and lack of funding allocated to these services. That is another thing. The problem could be lack of funding, and sometimes it could also be mismanagement of even the little funds that are allocated. People steal money, people are self-centered, and I think it really continues to hinder from benefiting from comprehensive post-rape care. Yeah, so now we have gone through those things, and we have gone for testing. We have realized we are positive. Now your test has been confirmed positive. Maybe you're a survivor of the rape case, you're positive. What next for you is the treatment that is now important, known as ARV, antiretroviral. So what is HIV treatment? HIV treatment involves taking medicine. The amount of HIV in your body. You take the medication to reduce the amount of the HIV, the viral load in your body. HIV medicine is called antiretroviral therapy. There is no effective cure for HIV. Currently, we don't have treatment. But with proper medical care, you can control. As I have told you, and I will repeat again, you can be positive but still live long and very healthy and continue serving this great nation and the world at large. But you must faithfully take your treatment. When you're given treatment, but sometimes your virus can develop resistance, go back to the health center and get proper treatment. When should I start treatment? You start treatment as soon as possible, as I've told you. Immediately you are diagnosed and you're positive, you're always advised to start your medication immediately. You see, when you're already positive, you don't say like, oh, give me time to think. No. You've already been confirmed that you're positive, and so they'll just advise you, please start your medication immediately. What if I delay treatment? Definitely, the viral load will continue increasing. The virus will continue replicating. You remember that the topic 6 where we were talking about how the virus replicates, and as it replicates, it keeps infecting new immune cells because it is multiplying. And as it is multiplying, it is using your body system. It is imitating your DNA. So it is making use of your body nutrients and everything and multiplying, and you start emaciating, your immune system weakens, you get exposed to other opportunistic infection. So if you delay, that is what will happen to you. So you are advised to start immediately. Treatment reduces the amount of HIV in the blood. So the amount of HIV in the blood is called the viral load. That one, this is more of repetition. We've already gone through this in past lectures. So taking your HIV medicine as prescribed will help keep your viral load low and your CD4 cell count high. These are the immune cells that help your body fight infection. So if you can keep this low, then you'll keep this high, then you'll be safe. That's why you can go tested and you're negative, but you have the virus, but it is at undetectable state. HIV medicine can make the viral load very low, called viral suppression. Viral suppression is defined as having less than 200 copies of HIV per millimeter of blood. So when you are here, when you're tested and your blood is tested and it is at this state and you are initially positive, you're a perfect human being, you're doing well. So HIV medicine can make the viral load so low that a test can detect it. It is called undetectable. If your viral load goes down after starting HIV treatment, that means treatment is working well. So we are in agreement with that. So if you skip your medication, even now and then, you are giving HIV chance to multiply. Yeah. When you start taking HIV drugs, you have to take them faithfully. You have to be very faithful, like you start being faithful towards these drugs. Yes. So treatment helps prevent transmission. You have undetectable viral load. You have effectively no risk of transmitting. I think we just bring more of like revision here. It has been said in the past lectures, the moment you're faithfully taking your drugs, it means when you're tested, you'll be testing negative, though you have the virus. So even if you have sex with someone, and let me tell you, even if it is unprotected sex, your partner will be safe. So having undetectable viral load may also help prevent transmission from injection drug use. Even those people who abuse drugs, we have seen what the needle syringe program does. It refers them to go take their medication and advises them on the importance of taking their medication faithfully. So it means even those who inject drugs, they'll be safer from spreading it from one person to another. We do not have data about whether having an undetectable viral load prevents transmission, though through sharing needle syringes of other injections equipments. That is just a statement. I got it from as I was researching on this. So having an undetectable viral load also helps prevent transmission from mother to baby. If a mother with HIV takes HIV medicine at prescribed throughout pregnancy, labor and delivery, and gives HIV medicine to her baby, this is something else I want us to capture, because people become mothers as early as some don't even plan for it. It is important. You don't know at what condition you got your child. Maybe you are infected and and definitely I love what the clinics do. Once you're pregnant, the first test must be HIV positive. Once they know you are positive, they advise you accordingly. And this point I want us to get, that even your child, you have to give the medication to your baby for 4 to 6 weeks after birth. Then this kid will be safe. The child will be very safe. I am telling you, I know of a case whereby the mother was infected, the mother didn't know. And I think it was not as serious as now, whereby once you start going for clinic, the first test they keep doing is HIV test. I think those times they never used to do, because this lady didn't know that she was positive. The husband had infected her. They had a child, and also she developed complication of giving birth to the child. She never knew that because she was HIV positive, and now the child, it was so sad, the child ended up being positive. So it really, I'm sure if that woman was aware of her status, or if the husband was a faithful man, or if the husband was real enough to tell her that she's positive, the woman would have been advised accordingly by the midwives. And I'm telling you, if the woman will be positive, that child will be safe. But it is sad. The child has to be told how she got to be trained. I think it is hard, but that is life. Now the child has to be trained how to live as a positive person, something that child did not wish on or on herself or on himself. Okay, we're almost coming to 9. So taking treatment as prescribed helps prevent drug resistance. We talked about drug resistance. The same way when you take antibiotics, you're always told, please finish up your dose, because the moment you take your antibiotics and you fail, that bacteria develop resistance to that drug. So the next time you try using that same antibiotic, it won't work. So because when you're tested, you're given treatment as per the strain that you have. So the moment you start taking, then you stop. It's like you make your virus more wiser. So it develops mechanism. Because before you worked on it, you stopped. You had started taking your medication, meaning you had started working on the virus. So you stopped. So once you have stopped, you have given now virus room now to re-strategize itself and now to multiply well. I'm promising you, when you go back to that medication, it won't work. So please take your treatment as prescribed to help prevent cases of drug resistance. Does HIV medicine cause side effects? It does. It can cause side effects in some people. However, not everyone experiences side effects. The most common side effects are nausea and vomiting. You can experience diarrhea, difficulty in sleeping, dry mouth, headache, dizziness, fatigue, and pain. Talk to your healthcare provider if your treatment is fit. When you're under medication, it's very important you keep visiting your health care. Offer you proper advice, and they offer you proper care. When you have side effects, you experience, they'll advise accordingly. So don't stop taking medication because of the side effects. You get advice properly. Okay. Will HIV treatment interfere with my hormone therapy? So far, there are no drug interaction between HIV medicine and hormone therapy. Talk to your healthcare provider. And the most important thing is always going back to your healthcare provider and talking to them. Don't advise yourself, as I've said, let the medic advise you. What if my treatment is not working? Your healthcare provider may change your prescription. A change is not unusual because the same treatment does not affect everyone in the same way. That's why you need to go get tested. You're found positive. You are advised accordingly. You are given the medicine as per your strain. And if there is any resistance or it is not working, they'll just change it for you. Sticking to my treatment plan is hard. How can I deal with challenges? You tell your health provider right away. If you're having any trouble, sticking to your plan. So kindly always go back to your healthcare provider. They'll advise you accordingly on what you need to do. Talk to your healthcare provider about problems while taking HIV medicine. Problem taking pills, this can make staying on treatment challenging. Your healthcare provider will offer you tips and ideas on how to go about it. So the moment you're confused, make your healthcare providers as your friends. You keep visiting them, keep seeking advice. In case of any side effects, they'll advise you and even change your medication. Treatment fatigue. Some people find that sticking to their treatment plan becomes hard. I know over time it's not easy. As we've said, also these drugs have other effects because they're also trying to work very hard to clear the virus in your system. Make it a point to talk to your healthcare provider about staying on treatment. So you've seen, anytime you have problems taking your pills, anytime you have side effects, anytime you have treatment fatigue, please go back to your healthcare provider. Please. Plan ahead and keep extra medicine. We are coming to the end of the topic, and that is the most important thing. When I know with the corona thing, we had issues. The drugs delayed. Also, we had carrier issues clearing at the port, and I know some people who are positive really demonstrated because they were not getting access to their treatment. And we've all seen that when you start this treatment, it is very important to stick to your treatment faithfully, to avoid cases of resistance. So the most important thing, once you start taking these drugs, please plan ahead, keep extra medicine with you. A busy schedule, work or travel away from home can make it easy to forget to take pills. It may be possible to keep extra medicine at work or in your car. I think, yes, you're positive, but it also forces you to be very positive in your mind. Like, this become parts of you. Make sure you keep some. You can keep some in your office, keep some in your car. Just have something and try planning ahead. Some medications are affected by extreme temperature, so it's not always possible to keep medication at work. But just always plan ahead. Know how safer to keep those drugs. Make sure even if you're doing traveling, as in pack them as the first thing so that you don't forget them. Yes. So find help for mental health or substance use disorder, being sick or depressed, how you feel mentally and physically can affect your willingness to stick to your treatment. As I told you, I think HIV is more mental and then now health. Like it's more mental than now your immune, now how your immune system. If you can work well on your mental, I think the treatment will go well. So when you're being sick or depressed, how you feel mentally can really affect your willingness to stick to your treatment. Your healthcare provider, social worker or case manager can refer you to mental health provider. Then as you stick to medication, it's very important to continue attending the counseling session. I know people who've been attending faithfully the counseling session and they start taking HIV normal and positive part of life and their life is moving on well. Yeah, sure. Alcohol or drug use, if substance use is interfering with your ability to keep yourself healthy, please stop it. Even when you're like people who have diabetes or pressure, they always advise to stay away from alcohol and for sure you cannot be you cannot be taking these drugs and then you also start mixing with alcohol. It will just interfere with your health. So if you realize it is interfering with your ability to keep yourself healthy, please stop. If you need help finding substance use disorder treatment or mental, please seek help. Yeah. So this is an NGO. It's an organization that has been brought up just to help people who are infected. What is SAMHA treatment locator external health treatment services locator, a confidential and anonymous source of information for persons seeking treatment facilities in the United States. It's actually like an online program. When after class, just go Google this and then you'll read more about it in the online. Like it's like from an anonymous person, and then there are questions you might not feel okay to ask anyone, maybe because of stigmatization. You can always ask them anything here and they'll always give you answers. Yeah, talk to your healthcare provider if you miss a lot of dose of your HIV medicine. Missing a dose, it's just a continuation. Now, on treatment, so missing a dose, in most cases, you can take your medicine as soon as you realize you missed a dose, then take the next dose at your usual schedule. Now, when you just realize you have missed, just take it immediately, then you take yours in your next schedule, unless your pharmacist or health provider has told you something different. So, going back, your health provider, those are your friends. Missing a lot of doses, talk to your healthcare provider or pharmacy about ways to help you remember. And I'm telling you, that's why I keep medication faithfully. Like you are so faithful to those medications. When you're faithful to someone, you don't forget about them, you don't hurt them, you keep remembering them. So just make this medicine, if you're positive, make this medicine like your friends. So keep remembering them. Purpose, not forget. Join a support group to ask your family and friends for support. They can help you stick to your treatment. And that's why I think with the, as in how things are flowing, it's time that HIV is no longer as it used to be demonized like in the past. These are the times when the parents are positive. There's nothing wrong allowing children to know that they're positive. They'll also help you remember taking your medication. Also, if one of you are the one who is sick, let your family, let them know that you want to live. Let them know that you're positive. They'll always remind you about your medication. Yes. Yes, I think of our lesson. Unless you have questions, I'll be happy to answer you. Maybe I can check the public chat for questions. Yeah, so we have gone through. Just a minute. I'm trying to check out to see whether there are questions. Yeah, so any questions? I hope we are still together. We have not lost anyone. It was a long one. We are to the end of this unit, and you would think 2 lectures to go or 1, I'm not sure. So any question? Any question? Let me see. Yes. Now, when are we having our cut? Yeah, we are having our second cut is a takeaway cut. So kindly, all of you, you go to your classes at 9. You'll meet your lecturers there. Your lecturers there, they will give you cuts. They will group you. And please don't miss out. They'll also be returning your cut 1. Yes. Yes. When is cut 2? Yes. You're being given your cut 2 today. I'll just repeat there for clarity. Yeah. Let us know when you're going to do. Yeah. I think all of you are asking for cut 2. I have already explained it is a takeaway cut. Those who fear sitting cut, you should be happy. It's a takeaway cut, but please, those who will be faithful also to do it in their groups will get the marks, and those who will not do it will be zeros. Yes. Oh, also, yeah, as they'll be returning your cut 1, please, those who did not sit for their cards, see your lecturers so that they can organize a makeup card for you. And only do that today. So those who are in the habit of missing classes, today please don't miss kindly there. Well, I'm trying to check questions so that I don't miss out on your questions in the public chat. Cut 1 papers. Yeah, we are returning today. Yes. Can one take antitherapy? The drugs, definitely you can never start medication unless you have been advised by your health care provider. You go first, get tested. Once they confirm you're positive, they get another team. They are sure that you're positive. Now they advise you accordingly when you can start your treatment. And maybe when you also suspect you are exposed to HIV, there is PEP. That one you don't need to wait to be tested to be positive. We're just suspecting. And sometimes when you know the nature of your work, keep exposing you to HIV and AIDS, so you take exposure, or you can take post exposure. So there is post and there is PrEP. But someone is asking, what if I don't like group work? I'm sorry, you have to do it. Yeah, thanks. What's a takeaway cut? A takeaway cut is a cut you're given and you do it in your groups. You return it. So you'll be returning it next week. That's why it's a takeaway cut. Like you don't do there and you return immediately. You're given, you go do, then you will bring it back. Yes. Kama sitaki kufanya kati ya group, I'm sorry, you have to do it. Now, your work has been amazing. Thank you for your positive feedback also. I appreciate. Yes. Chudwa, thank you. Thank you. I think I can't see more questions. It just means that then you got it. This school, where can I get self-test kit for HIV in this school? I think you will visit the healthcare unit and then they will advise you accordingly. Yes. Goodbye, kindly. Then. Yeah, I think there are no more questions. Yeah, thank you very much also for your positive feedbacks. We really appreciate. Have a nice time and keep revising. Your exams are around the corner and I really appreciate your time. Thank you. Goodbye.